Hey everybody, it's Tracy. I am alive, but today has been a really tiring and exhausting day. I have, for those who don't know, I have two children who are graduating high school this year. My son Sam, who's 18, and my daughter Emily, who's 17. Sam is kind of doing a dual enrollment. He's going into IT. He has decided not to do the 4-year college route because he just needs specific, skilled trades training for what he wants to do. So he's going that route. Emily is an artist and a digital artist primarily, and she's wanting to go into animation. And so we went to an open house at visitation day at a college that's relatively close to us. That's about an hour's drive-ish. And there was lots of walking. Walking between buildings and having to go to, that department that deals with animation and going, and seeing the labs and different things like that. And then, walking all over the place. And it was exhausting. I didn't take my walker with me because I had my husband there and I could just hold on to him. But there was a lot of up and down stairs. They probably had, we did take an elevator once. I know they have elevators, but if you follow the group so you know where you're going, it was up and down the stairs. And I did all of that, and I was not doing good. That we had to leave about 7 a.m. to get there by 8. We got there about 8:15. Everything started at 8:30, and we left at about noon, a little bit before noon, and they served lunch. I could take literally 2 bites of the sandwich, and I was done. My blood sugar was dropping. I couldn't eat. My stomach was just having none of that, and I was not in great shape. So I came home and took a nap. My husband had to go to work, so we took 2 cars, so he couldn't even drive me home. It was good, but oh my gosh, college is just insanely expensive. This one was going to be, I don't know, over $40,000 a year. We looked at a couple different schools. One that she wants to go to or would like to look at is $56,000 a year. The state college, not that far from our house, about equal to the one that we went to today. It was only $27,000, but they don't have an animation program. They have a digital storyline program. That's what you would graduate. Your BA would be in digital storyline. And they teach some animation, but that's not the primary focus, and that's not what she's wanting to do. So I don't know. We're just looking at some different options. At the school that we went to today, she's already applied and been accepted and received a $14,000 grant or scholarship based on her ACT scores and her grade point average, which is good. And that's good, but there's still a big gap between $14,000 and $40,000, which was the total due. So we've got all that going on, and we get ready to start filling out the FAFSA. Anyway, it's difficult for me with my cognitive issues, and my husband works 7 days a week, and he works second shift. So, and we're trying to get the kids licensed. None of them are driving. Now, Sam is really close. I think by December he'll be licensed. We haven't even started with Emily. She really has no desire. We sold the extra car that we had, got enough that we're going to buy 2 cars for the kids, have them all paid for, and have them cars to drive. I still don't know yet what's going to happen with the school things. So I'm stressing about the graduation party that I know we're going to have. My family stepped up and said, don't worry about it, we'll help. My daughter-in-law is like the queen of party planning, and they live close to me, and that's my son and, his wife, and that's my 2-year-old granddaughter who I watch, who's turning 3 on Tuesday. So I think Monday I'm going to go take her shopping and go, all right, B, what do you want? We're just going to go take her, and I'm just going to go buy her what she wants. So I think that's what we're going to do on Monday when she's here. Go take her birthday gift shopping. Other than that, I'm healing from my fall that I had on Tuesday. I've got horrible bruises. I'm very sore, but I'm getting less sore as every day goes on. It's just been busy, and I'm really tired. I mean, really, really tired. So I'm looking into getting ketamine. My pain management doctor does not do ketamine himself. My neurologist doesn't do ketamine. But there are 2 doctors that are kind of sort of part of the group that my pain management doctor's in, and 2 of them do ketamine. I talked to their scheduler. She's going to talk to those 2 doctors on Monday because I think most of the ketamine that they do is for depression. I mean, I have severe depression, general anxiety disorder, and bipolar 2. I'm on medication for that. I don't know if they would be able to, based on those diagnoses, be able to give me ketamine infusions. I keep hearing rumors that ketamine's not even covered by insurance because it's not FDA approved for usage for things other than like PTSD and depression. But, I took an Alzheimer's drug that also was not approved for chronic migraine prevention. My insurance paid for it. Ketamine has been used since the 60s as an anesthesia, so my insurance covers pretty much anything. I have never had them deny coverage of anything. And treatments and things like that pay 100%. So we'll see. I don't even know if the doctors will agree to try a ketamine infusion or anything on me at this point, but I'm hoping if they do, it will maybe break my intractable migraine cycle and get me down to no pain or very, very low pain, help with my fibromyalgia pain and my osteoarthritis and all of my spine issues that I get injections for, and my occipital neuralgia. So I have osteoarthritis in all of the facet joints up and down my spine. I have bulging discs. I have mild stenosis in one spot. I have several Tarlov cysts, which are cysts that grow out of the nerve sheath and are filled with spinal fluid, and so compress and make, limited room. And mine are in my cervical area, which is highly unusual. They're normally in the sacral or low lumbar. I have numerous hemangiomas on my thoracic and my cervical. Again, it's unusual to have them in the cervical, but I got them from the very top down, and I've got a really bad one like at my T10, but I've got them in numerous spots from T10 up. And one of them has now become infiltrative, which means it's growing out, exceeding beyond the vertebrae. And a hemangioma is a tumor on the vertebrae. And they say, oh, they're not supposed to be symptomatic until it eats away at the bone of the vertebrae and it collapses the vertebrae and fractures. But it's not supposed to hurt before that. So I've got all that going on, and I'm wondering, since I'm taking so many medications, I'm hoping that the ketamine infusion will address all of my pain. Wouldn't that be great? I don't have to take all these different medications. I can just do ketamine infusions. That would be awesome. And it's supposed to last a little while. I think it depends on the person, and I think you kind of got to get, go through so many dosings till it builds up, kind of like they do with Botox. You kind of have to go through 3 of them, and then it's supposed to last a while, 3 months. If I can have to only go every 2, 3 months, 4 months, whatever with the ketamine, that'd be awesome, because then I'm not having to take all these pills every day. So that's what I'm doing. I'm just kind of researching other options, because the Namenda that I was on to prevent migraines didn't work. The FAFSA that I was on to try to control my fibro pain didn't work. So I have pretty much tapered off of those, and I'm done with those, because I don't want to take medication that is not working. I mean, it just seems ridiculous to me to keep those chemicals in my body if they're not doing what they're supposed to do. It didn't cost me much. I think it was costing me less than $1 on my prescription plan to go buy Namenda and FAFSA. It wasn't costing me a lot of money, but it doesn't work. I don't need to take and have the side effects and have that drug in my body if it's not being effective. So that's where I'm at. I'm just really tired. My ear surgery, everything went well. I went for my follow-up. It's fine. I still have a little bit of a plug in here. It's kind of like a skin glue plug, because they split this little, little thing that sticks out on the front of your ear. They split that and kind of adhered it and sewed it on the front canal. And then they cut all behind my ear, laid that over, and went in and had to clean up a bunch of mess in there from my original mastoidectomy surgery 32 years ago. I guess it had growths in there, and it had remaining residual stuff from infections. He said that was not doing you any favors, so he had to go in and clean all that out, and then he had to seal up and trim and seal up, and then seal it from inside, so my ear canal is completely sealed off, because I have profound conductive hearing loss in that ear, and I don't need my ear canal to hear. I only had just a little bit of hearing using the canal. I have, and I don't have it on right now, I have a post in my head. I have a Baja bone conduction hearing aid implant. Literally drilled a hole in my head with a titanium rod, and I have a hearing aid that snaps onto that, and that's how I hear out of this ear. And when my phone rings, I've got an app, and it rings directly to my hearing aid. So it's pretty awesome. Anything I do on my phone, which I'm on to record this, like music or anything I want to listen to, it just goes directly, or apps if I'm watching a movie or a show. Like when Bee's here and she's watching a show on the TV, I can actually sit and watch something on my phone, and it goes to my hearing aid, and nobody else can hear it but me. So it's pretty cool. But anyway, I'm just resting. I've not been posting a lot because I've been busy, and when I'm not, I'm trying to rest and recuperate and not fall anymore. That'd be great, wouldn't it? I'm so worried when I fall like that, because I have osteoporosis. I'm afraid I'm just going to fracture something. That's my biggest concern, is that I'm going to fracture something when I fall. And I have my worst osteoporosis is in my spine. So go figure, it's not a hip, it's my spine, where I have all the other issues. And it's like, if I fall and fracture my spine, I can't even imagine. Wouldn't that be fun? So anyway, I hope everybody else is doing good. I am going to go back to watching my shows and resting in my bed and trying to recuperate. I'm going to be resting a lot tomorrow, maybe. I got to take a shower and wash my hair and stuff, because I've got B again on Monday, and we have to go birthday shopping. So anyway, hope everybody's doing well, and I will talk to you soon.